I'm going to talk about mental health and mental illness as it relates to our students. Good mental health allows each of us to realise our own potential. It enables us to withstand the day-to-day stresses of life and work productively and contribute to our communities. Maintaining good mental health is a balance of risk factors and protective factors. Risk factors include ongoing stress that might come from work or home life. For our students, it might be about finances. It might be living away from home for the first time that causes them stress. Sharing accommodation with others, maintaining high academic expectations, working on a research project that's not conforming to plan. One-off life events are also risk factors. Often, but not always, these are adverse life events, for example, a bereavement, ending a relationship, but also the birth of a new family member, weddings, going to university, graduating, can also be stressful. And then there are also biological or developmental risk factors. We know that the onset of some ongoing mental health conditions, such as anorexia or schizophrenia, is often during early adulthood. The most up-to-date statistics suggest that common mental health disorders, anxiety and depression, are increasing amongst young women aged 16 to 24. Protective factors include good diet and exercise. There's good evidence that exercise is an effective treatment for depression. Work and purposeful activity, that's enjoyable and engaging, that gives structure and helps us get out of bed in the morning, is also protective. And relationships. For our students, universities can offer a great potential for building relationships, but transitions to, during and from university can also disrupt or limit access to relationships that have been supportive in the past. With this ever-changing balance of risk and protective factors, we will all at times feel down, stressed, anxious. Most of the times these feelings pass, but sometimes we can experience more serious problems, and that can happen to any one of us. So how do you know the difference between the normal ups and downs of life and what might be a mental health difficulty that would benefit from further support or intervention? Well, mental health can be viewed on a continuum, ranging from those everyday ups and downs and negative emotions on one end to more severe mental health difficulties on the other. Where you fall on that continuum will depend on the frequency, intensity and duration of your difficulties. So for example, being low in mood, feeling down in the dumps, feeling fed up for a day would not indicate a mental health difficulty. But if that lasted for a couple of weeks and was so severe that you spent half the day in bed, then that's looking more like depression. Or a single panic attack would be unpleasant, but it's not out of the ordinary. But panic attacks that occur frequently or that result in someone being frightened to leave the house, that would indicate a more serious problem. So finally, how might you as a personal tutor become aware that a student is struggling with a mental health difficulty? Well, first of all, the student may actually approach you and tell you they're having difficulties. They may be seeking access to wellbeing services. They may be asking for support in relation to extenuating circumstances. Alternatively, you may notice a deterioration of students' academic performance or in attendance. Following this up may highlight underlying mental health difficulty. You may also notice other changes in the student's behaviour. They may appear withdrawn, they may be tearful, they may appear angry, they may appear underweight or appear to be neglecting their appearance. They may appear disinhibited or to be acting in ways or speaking in ways that are hard to make sense of. Noticing any of this would be an opportunity to ask the student in a very straightforward way, how are you doing? And at that point, if you think the student may be experiencing a mental health difficulty and they're not already in touch with support, you should signpost to or get advice from a trained mental health professional within the university.